I don't think we could have had a better set of professionals doing the, the, the kind of practice that they're engaged in and sharing it with all of us and really thinking through some of the critical issues from an ethical perspective as well as practice perspective and balancing that with the realities that so many of us are confronted with. So I'm very grateful to the three of them. There's nothing like ending a late night presentation with a state bureaucrat. But let me say there has been discussion throughout this evening about policy. And you may not be aware relative to the criminal justice system and treatment, et cetera, we had two really well done criminal justice reform pieces of legislation in this last session. A lot of that work was built on a criminal justice reform task force that Justice Ed Chavez chaired, which I participated in. There was a $41 million appropriation attached to that legislation. This was intended to be modeled after work done by the Council of State Governments, and there are many states who've adopted this model that includes basically three legs of a stool: meaningful diversion for folks that have behavioral health conditions and don't warrant incarceration because of the severity of their crime. Secondly, those that end up incarcerated, that there's appropriate treatment, both on the mental health side as well as on the SUD side. And thirdly, that there's meaningful reentry and supports on the back end. What they found, for example, in states like Alabama, which historically has not been thought of as one of our more progressive states, they began implementing this model about 7 years ago and built a data system to track things like recidivism and also correlating that with their public safety numbers. They have, as a result of doing this, closed 6 state prisons in the state of Alabama. And the savings from that have been reinvested in building more community supports on the diversion side and on the reentry side. And they have found that individuals who can have the supports necessary in the community to reach year 3 in their recovery, only 5% will recidivate. So their public safety metrics in Alabama are off the charts because the theory has been historically, well, if you're soft on these people, you know, they're going to go out, rape, pillage, and plunder, and, you know, et cetera. And the findings are just the opposite. So we were hoping to benefit on that experience. The data's there, it's supported, and the $41 million got stripped out of both measures and in the end a lot of the content as well. So we were left with $2.5 million coming to my division July 1st to give out county grants for detention centers and counties to figure out how to do some things differently. So it's a small measure in comparison to what we intended, but I think we really have another good shot next legislative session. This is indeed a transformative piece of public policy that we all need to rally around come the next session. The last thing I want to leave you with is if you're not aware of our social media campaign and web portal, Dose of Reality, that everything you want to know about the opioid crisis, MATS, et cetera, and it is indeed a social media platform. Last month, we had 3,500 people actively engaged in communicating between folks in long-term recovery with folks who hadn't even initiated treatment yet, providing peer support, education, et cetera. So if you're not aware of that resource, I encourage you to go there, and we keep adding new content to it all the time. So with that, thank you so much for being here this evening. If you're going home, safe travels. If you're sleeping here tonight, sleep well. Thank you.